Hello, I'm Susan Moore for Spirit of Women and the Cardiovascular Institute. We Spirit of Women members have so many advantages in that we get to find out the information from the fabulous doctors right here in Northern Colorado. And one of those is Dr. Beckmann. Hello, Dr. Beckmann. Thank you so much. We've talked before about cardiology.
We have.
Yes, we have. And today we want to really focus on PAD and what that is.
So PAD, P-A-D, is the acronym for peripheral arterial disease.
Okay.
Others may have heard of CAD, coronary arterial disease, but today we're going to be talking about the peripheral arteries that are involved in this process.
So what are the symptoms of PAD?
Well, in PAD, or peripheral arterial disease, blockages or narrowings develop in the arteries, and we'll talk specifically about the legs. And as the narrowings or blockages develop, they narrow the openings in those arteries, so there's less blood flow getting down to the legs.
So that's the connection between heart and legs?
Well, there's a similarity
Okay.
that this process, the general name is atherosclerosis, develops in all the arteries. And so it's occurring everywhere. In the periphery, as it affects the legs, a person may be walking and they may note that as they're walking, their calves start cramping on them. So they actually are forced to stop. And when they stop and rest, the discomfort may get better. And it may be in the calves, others may experience in the butt or the thigh. It can be in the legs, but it's the reduced blood flow because of this process. Others, when it's in the coronary vessels, which we're really not going to talk about, may get chest discomfort, which forces them to stop. But in peripheral arterial disease, it's in the legs itself.
Is there something that you would look for or your doctor might look for to determine if you have PAD?
Well, your doctor may not ask you if your legs hurt when you walk. And it's something really that you may have to bring forward and say, you know what? I could walk a mile, I'm down to a fourth or a third of a mile now, or I'm just walking a flight of stairs or going up the hill or the driveway now to get back to the garage. They're hurting me. And that may clue him in to start asking specific things. And it may be, how has it progressed? How have your symptoms or your ability to perform has declined? Then he may look at other things that he may or may not already know, and that is, what's your risk of really developing these blockages? If you're diabetic, that really does put you, unfortunately, at high risk.
Sure.
If you smoke, that also puts you at high risk. But the other things, high blood pressure, high cholesterol, bad diets, those are the issues that would be addressed as we start looking, do you potentially have this problem in the arteries and the legs?
So if there's this problem with the arteries in the legs, does that mean there's probably problems other places?
There is a very good chance there is. If we really want to look at numbers, 2/3 of the people that have symptoms in their legs or have the PAD have it already in their coronary vessels also. Not everybody, but most will. And so that's something that your physician wants to try and ask you about also.
Well, would your doctor be checking the pulse in your foot for that?
Hopefully so. If you tell him that, you hope so. But there are other things too. You may note that, and a guy maybe more so, because they're not going to shave as often as the lady.
Oh, right.
But loss of hair on the legs.
Oh.
Even the skin may become shiny and thinned looking. More advanced, and in particularly in diabetics, it may have taken a very long time for a blister to heal. Or there may be a sore on the tip of the toe that, well, I've had it there, I think my shoe is just rubbing against me, but that sore is not healing. And that itself also may indicate that these blockages are reducing the flow to the leg and the foot enough that you can't even heal an ulcer or a sore that has opened up.
Are there any medications that we're not aware of that we should be?
Well, the things that probably most of us nowadays have heard about that's been in the public, and as I mentioned, the risk factors, the cholesterol, is watch the diet. And then everybody's heard mostly about the cholesterol lowering agents, the statin agents. That may be one also that you're going to be put on. If your blood pressure's high, then you're going to need to be on blood pressure medications. The diabetics, for sure, we want to make sure that their sugar is controlled as best as possible. Specifically for the peripheral arterial disease, there are some other medicines that they may try, fancy names for them, and have you on for 3 months to see if it improves your ability to walk. And then even a simple aspirin a day, they may have you take.
Really?
You had mentioned about should they feel your pulse? Yes, but there's some other things. There's some other things that may help out there too. And it's actually very simple. Everybody's aware if you go in and you get the blood pressure taken in your arm. Well, if there's a concern about the blood flow in the legs, we do a blood pressure at the ankle.
Well, of course.
So if there's a blockage, the pressure will probably be lower. So we compare the blood pressure in the ankle to the arm, and if it's lower in the leg than it is in the arm, then that adds to the suspicion that you have a blockage in the leg. So just a simple blood pressure measurement in the leg greatly adds to the diagnosis of having PAD.
So we've made the lifestyle change, we've tried the medications and the statins. If those don't work, what's the next step?
Well, we still have other options.
Okay.
And hopefully we've made some improvement in symptoms that the person can walk further, they'll have having less discomfort in their legs. But one of the first things that we want to know is where are the narrowings? So we have narrowings in the legs, they're reducing the blood flow. And we may do an angiogram, and that's to define the blood flow in the legs and where the narrowings may be. Depending on the anatomy or what the narrowings and blood flow looks like, we may try and open up those arteries with like a balloon or cutting it out rotor-rooter style, or even stenting it to try and improve the blood flow so that we can reduce the symptoms that that person is experiencing. Depending on how complex the narrowings may be, we may have to consider other options, such as even open surgery to bypass those narrowings. But somehow, whether it's using balloons or cutting devices or stents or surgery itself, we want to improve blood flow so that we can reduce the symptoms and even promote healing of that ulcer or sore that have not been able to heal.
Wonderful. Dr. Beckmann, thanks so much for educating us on PAD and the things you do as a cardiologist. We really appreciate the information.
Thank you for having us. It's a pleasure to be here with you.
I am Susan Moore for Spirit of Women and the Cardiovascular Institute.